Right. So hello, everybody. Thanks for joining us tonight. I'm going to talk today about the role of plant-based diets, as Rahini just said, for the prevention, management and treatment of diabetes. So first, just a little bit about me. I'm a dietitian certified, am I recording? Hold on. Certified lifestyle medicine professional. I have previous NHS experience in the community and as a diabetes specialist dietitian. And I'm now, as you know, as the education lead of plant-based health professionals. And I also have my own freelance practice as well, called Plant Life Nutrition. We're going to discuss the causes and drivers of type 2 diabetes, how plant-based diets can reduce the risk and even treat the disease. And I'll finish by offering a few tips on how you can help yourself or others transition to this way of eating, and other lifestyle factors as well to take into account. So we know, don't we, that the number of people worldwide with diabetes is growing really rapidly. And there are also huge numbers of people who are unknowingly living with diabetes as they remain undiagnosed. Around 90% of cases of diabetes in the UK are type 2 diabetes, and it's type 2 diabetes that I'll be discussing this evening. So if I talk about diabetes, it's type 2 diabetes I'm referring to. And of course, diabetes can lead to many serious long-term consequences. And here's a snapshot of the weekly burden in the UK. Yet we know, don't we, that with the right environment and lifestyle, this can largely be prevented. So what's going wrong and how can we help? So this is a quote I'm sure many of you may have heard from Dean Ornish, and it nicely sums up how I feel about it. It says, disregarding the underlying causes and treating only the risk factors is somewhat like mopping up the floor around an overflowing sink instead of turning off the faucet. So we need to turn off the tap. We need to get back to the cause, to the beginning of the long progression towards type 2 diabetes. So what is the cause of type 2 diabetes? Well, we think it largely starts with what and how much we eat. So we know that dietary, lifestyle and genetic factors affect all the following processes at different points and through different mechanisms, which will hopefully become clearer as we move through the talk. Ideally, we should store any excess carbohydrates and fats that we eat either as glycogen in our muscles, or liver and subcutaneous and fat under our skin. But if those stores are overwhelmed, we start to inappropriately store this excess energy as fat inside our abdominal cavity and inside our liver, muscle and pancreatic cells. And this fat causes inflammation and damage to the cells of these organs, and they become insulin resistant, no longer responding to the insulin, which is secreted from the beta cells of the pancreas. So insulin normally allows the glucose to move from the blood into the cells to be used as energy. And therefore, glucose starts to build up in the blood because this isn't happening properly. So as blood glucose levels rise, the pancreas secretes more insulin to try and correct this. And insulin also increases hunger and drives further fat storage. So you can see it becomes a vicious circle. And ultimately, the pancreas can't keep up. And the beta cells themselves start to show functional failure. And the blood glucose levels can no longer be controlled and they're consistently high. And that's when we end up being diagnosed with diabetes. So we often tell patients as health professionals that it's insulin resistance that's the cause of diabetes. But you can see here that that's not the beginning of the story. That's in the middle of this chain of events. So we need to try to stop this inappropriate fat storage by looking at the cause of that right at the beginning, at the top, at the source of the leak. So what do we have in terms of evidence for these dietary, lifestyle and genetic factors being implicated in this progression towards type 2 diabetes? Well, as you know, when studying nutrition and lifestyle, we often rely largely on these big prospective cohort studies, and they follow a large number of participants through time, often for decades, observing their lifestyle, their health markers and diseases. And we're then able to analyse collected data in these studies. So we'll just have a look at a few of these tonight. So in this study, there's over 60,000 participants, and the researchers looked at the association between dietary pattern, body weight and prevalence of diabetes. And as you can see from these bar charts, BMI of participants decreased in line with the reducing amount of animal-derived foods in the diet, and so too the prevalence of diabetes. And even after adjustment for the lifestyle factors and BMI, vegans had half the rate of diabetes compared to the non-vegetarians. And this population are actually fairly health conscious due to their religious beliefs. So even the non-vegans didn't eat much meat, suggesting that even small amounts of meat can disproportionately increase the risk of type 2 diabetes. And this analysis, called the 3 cohort studies, is from the Nurses' Health Study, the Nurses' Health Study 2, and their Health Professionals Follow-up Study. The researchers followed more than 200,000 health professionals for more than 20 years. And there's often not enough vegans in these studies. And when there is, we don't always know about the quality of their diet. So this study examined the association of diabetes, with overall plant-based diet and healthful and unhealthful plant-based diet using the plant-based diet index. And that's essentially, it's a scoring system that helps researchers better understand the association between plant-based diets and health. So people scoring high on the healthy plant-based diet index aren't necessarily 100% vegan. They're the people who eat the most healthy plant-based foods compared to those who eat the least. So the x-axis here is the level of adherence. And you can see that the more a diet emphasizes plant foods and is low in animal foods, which is the blue line, the overall plant-based diet, the lower the risk of diabetes by 20% at this most extreme decile. And the consumption of a diet that emphasized healthy plant foods, which is the green line, was associated with a 34% decrease in diabetes risk, whilst the plant-based diet high in less healthy foods, the red line, was associated with a 16% increased risk. So there's actually a 50% difference between the healthful and the unhealthful plant-based diets in risk here. An updated analysis from the same study cohorts aimed to examine associations between changes in adherence to plant-based diets over time and subsequent risk of diabetes. So adherence to the plant-based diets was assessed every 4 years. And the results showed that improvement of diet quality over time can reduce the risk of developing diabetes with every 10% increase in adherence to plant-based and healthy plant-based diets, reducing subsequent risk of diabetes by 7 to 9% during the following 4 years. And the converse was also true, providing evidence that it's never too late to make changes. So that's a positive thing from there. And what about genetics? Well, a separate study from the Adventist Health Study, which is the first one I discussed, the researchers also looked at ethnicity. And we know some ethnicities have an increased risk of diabetes. And here, Black ethnicity was associated with about 1/3 increased incidence of diabetes. Analysis of the Black participants showed that those following a vegan diet had around 70% reduction in odds of developing diabetes compared to the non-vegetarians. And the lacto-ovo vegetarians had around half the risk, and this is after adjusting for all the confounders. So this was a slightly larger odds reduction than the non-Black participants in the comparable data set. And so it does suggest that a plant-based diet may be a really effective way for the Black population to try to counteract their increased risk of disease. And we also know that, unfortunately, the Asian population do tend to incur diabetes at a younger age and a lower BMI than Caucasians. So this study cohort was a population of Taiwanese Buddhists, and were not very overweight on average, although Asians do have a lower cutoff for a healthy BMI due to their genetic risk. And again, the omnivores in this study ate very little meat or fish, yet even still, the vegetarian men had approximately half the rate of diabetes, and the vegetarian women approximately 1/4 of the rate of diabetes compared to their omnivorous counterparts. And there were no cases of diabetes recorded amongst the 69 vegan participants. So this again does imply that even small amounts of meat consumption can contribute significantly to the development of type 2 diabetes. So let's look at the lifestyle factors now. So this recent meta-analysis of prospective cohort studies evaluated the relationship between a combination of low-risk lifestyle behaviours and the incidence of type 2 diabetes. There were 1.7 million participants from 30 cohorts and over 75,000 incident type 2 diabetes cases over the 12 years of the study. So you can clearly see here the inverse dose response gradient with the increasing number of healthier lifestyle behaviours adhered to. And with each additional lifestyle behaviour, there was a 33% relative risk reduction in diabetes, reaching a global risk reduction of 85% with adherence to all 5 lifestyle behaviours. And we know, don't we, how all the pillars of lifestyle medicine interact with and affect each other. So it's really important not to neglect them and not just focus just on nutrition alone. So for physical activity, studies show that both moderate and vigorous cardio exercise significantly reduce risk of developing diabetes in the short and long term. And there are studies that show that strength training is effective at reducing HbA1c in people with diabetes. And another recent study has shown that muscle and liver insulin sensitivity increased using lifestyle change, but much more significantly in those using diet and exercise than those using diet alone. And then the other pillars, we know that stress affects so many aspects of our health, such as our gut hormones and how we metabolize our food. And the same goes for sleep. And we are far more likely to reach for unhealthy snacks, aren't we, if we've slept poorly the night before. And there's so much we can do to improve our sleep, written on the slide here in terms of sleep hygiene. There's a lot more to say about the lifestyle pillars, but we will be going into each of these pillars much more deeply over the coming months in webinars and in our conference day in the autumn. So let's go on to look at the dietary factors involved in the progression towards type 2 diabetes. So this huge global study set out to establish and quantify the contribution of dietary factors to the risk of type 2 diabetes. Suboptimal diets were found to be implicated in 7 out of 10 new cases globally. But what is a suboptimal diet? Well, the researchers considered 11 dietary factors. And as you can see here, our diets are currently too high in refined grain products, processed meats, red meat, and sugar-sweetened beverages, and insufficient in whole plant foods, primarily whole grains, but also fruit, nuts and seeds, and non-starchy vegetables. So let's look at some of these foods and their components and try to break down what's happening. So refined grains can be found in many shop-bought processed foods. That includes white breads and pastas, but also donuts, pastries, biscuits and cakes, and many breakfast cereals, things like that. And the problem with refined grains is in what they are lacking as well as what they contain. So they've had most of their fibre and many of the beneficial nutrients stripped away, and they can contain many harmful chemicals and additives such as fructose, sweeteners, fats, emulsifiers, and so on. And this means the foods are often high in calories, but not filling, and therefore contribute to weight gain. And many of the additives have negative effects on our gut microbiome as well, which also impact our diabetes risk. And free fructose, which is found in these foods and in sugar-sweetened beverages, is also implicated in the progression towards fatty liver and insulin resistance. Free fructose is metabolized within the liver, and it produces some glycogen stores and also triglycerides, which increases blood triglyceride levels. And it also promotes lipogenesis, which is the production of more fats, and it's this fat that accumulates in the liver. And long-term fructose ingestion promotes leptin resistance, and leptin's a hormone that helps you to feel full. So resistance to this drives hunger and leads you to eat more. And additionally, a high fructose diet negatively alters the gut microbiome. The next biggest negative dietary factor in that study was excess intake of processed meat and unprocessed red meat. This study from autumn last year provides us with some very strong evidence that eating unprocessed and processed red meat increases the risk of type 2 diabetes. This is the largest observational study addressing this question to date. And the results showed that participants who ate the most red meat had a 62% higher risk of developing diabetes compared to those who ate the least. And there was a dose effect showing in the continuous analysis that with every additional daily serving of processed red meat associated with a 46% greater risk of developing diabetes And with unprocessed red meat, it was 24% greater risk. And then looking at the figure on the right here, substituting red meat with a serving of nuts and legumes was associated with a 30% lower risk of diabetes and an over 40% reduction when substituting from processed meat. But note also that substituting for fish, poultry or eggs did not modify the risk. It may even worsen the risk. So what's wrong with meat? Well, meat is high in fat and it has no fibre. But beyond that, it also contains several compounds which have negative effects within our bodies, contributing to the risk of diabetes. So nitrates and nitrites used as preservatives in processed meats and fish are converted into nitrous amines in our gut. And these have been shown to have toxic effects on the beta cells of the pancreas. And they promote insulin resistance through the activation of pro-inflammatory cytokines and the generation of the reactive oxygen species. Heme iron found in meat and fish is touted as being better because it's absorbed more easily than non-heme iron found in plants. But in fact, this is a problem as heme iron causes oxidative stress and inflammation in the body, which again promotes insulin resistance. And it can't be excreted by the body, so it can build up if consumed in high amounts. And cooking meat and fish, especially in dry heat, such as on the barbecue or grill, produces advanced glycation end products. Now, these have been found to cause oxidation and inflammation, as well as stiffening of the arteries, which increases the risk of the vascular complications of diabetes. And animal protein has been associated with increased risk of diabetes. In fact, the EPIC study found that for every 5% of calories derived from animals, but not from vegetable protein, there was 30% increase in the risk of developing type 2 diabetes. And choline and carnitine from meat and eggs is converted to trimethylamine oxide in our liver and our gut. And this substance drives inflammation and insulin resistance. And saturated fat found in animal products and in tropical oils have direct effects upon the have direct effects above and beyond the contribution to weight gain. So people who eat more saturated fat have an increase in gram-negative bacteria in the microbiome, and these bacteria damage the gut wall, causing it to become leaky. So these result in endotoxins leaking into our bloodstream, and they drive chronic inflammation and induce insulin resistance. But saturated fat does more than just that. Along with fructose, saturated fat drives that inappropriate accumulation of fat in the liver and muscle cells that I mentioned earlier. And this study found, independent of body weight, that vegans have lower levels of intramuscular fat, better beta cell function, and better blood glucose levels than matched omnivores. And in the clinical setting, this randomized control trial found a low-fat vegan diet, which did not restrict energy intake, led to a 34% reduction in fat inside liver cells and a 10% reduction in fat inside muscle cells, and that this correlated with improvements in insulin sensitivity. And in this study, palmitic acid, a saturated fat found in meat and dairy, was shown to be directly toxic to pancreatic beta cells, whereas oleic acid, an unsaturated fat found in plant foods such as olives and avocados, were protective. So this image shows insulin secretion from beta cells, which were incubated with either palmitic acid or oleic acid or both. And the higher green fluorescence represents higher insulin secretion in the beta cells. We can see that the insulin secretion is much higher in the presence of the oleic acid and in the presence of both the oleic and palmitic acid, but there is very little insulin secretion with only the palmitic acid. And it's also found that oleic acid is stored neutrally within the cell, whereas palmitic acid is not stored neutrally, and promotes the incorporation of saturated fats into the cell membranes. And palmitic acid also causes oxidative stress, endoplasmic reticulum stress, inflammation, and cell death. Oleic acid alone had the opposite effects and offered protection to beta cells in the presence of palmitic acid. But there is good news. So let's look at the benefits of plants. Conversely to animal products, plant foods are full of antioxidants, and anti-inflammatory compounds. So they drive down the chronic inflammation and drive down the oxidative stress, mopping up those free radicals. One such group of plant nutrients is called polyphenols, and they're thought to stimulate insulin secretion, reduce glucose output from the liver, enhance insulin-dependent glucose uptake, positively modify the microbiome, and have anti-inflammatory effects. So polyphenols are most abundant in tea, in colourful fruits and vegetables, and in whole grains, nuts and seeds. And plants are also full of fibre, which we know fill us up, and they feed our gut microbiome. It supports the expansion of beneficial bacteria, and it keeps opportunistic pathogens in control. Fibre is associated with decreased inflammatory markers, which improves insulin sensitivity. And it reduces the energy density of food, so it promotes satiety, and it is associated with weight loss. So this new study from January this year investigated the potential mechanisms to explain the lower risk of diabetes observed among individuals following plant-based diets, using prospective data from the UK Biobank. The result shows healthy plant-based diets reduce risk of diabetes by 24%, but lower body weight only partially explain these results. So by studying blood markers such as glucose and fat concentrations, liver enzymes, inflammation and kidney function markers, and growth factors, they concluded that mechanisms at play are likely to include better blood glucose control and lower levels of inflammation, as well as improved kidney and liver function and a healthier gut microbiome. And we know that fibre is food for our gut microbiome. The microbiome ferments fibre, producing short-chain fatty acids such as propionate and butyrate. And these compounds in turn feed the cells that lie in our gut. So our behaviours and diet influence how tight the junctions are between those cells. And if permeability is increased, such as with saturated fat intake, then parts of the opportunistic bacteria are able to cross into the blood, producing a pro-inflammatory response. And gut bacteria also synthesize some vitamins, and the short-chain fatty acids produced by our gut bacteria have other beneficial effects as well. They reduce post-meal levels of glucose and free fatty acids, and propionate has been shown to directly improve beta cell function and protect against the damage caused by free fatty acids by inhibiting programmed cell death. So what about the treatment of type 2 diabetes? We've talked about sort of prevention more so far. Well, an expert consensus statement was published last year from the American College of Lifestyle Medicine on dietary interventions to treat type 2 diabetes in adults with a goal of remission. It contains 16 consensus statements down here, and they're regarding dietary specifics and types of diet. And there's a very strong emphasis on whole food plants, whole plant foods being the most effective way to achieve and maintain remission. In addition, they agreed that very low carbohydrate diet can be associated with significant adverse effects and cardiovascular risk, making it inadvisable for long-term remission of diabetes. Most interventions for remission of diabetes are aimed at weight loss, and this is required for most people to achieve remission. We know that a plant-based diet is the optimal way to achieve a healthy weight, and this was demonstrated in the BROAD study, where intervention participants were supported to follow a non-energy restricted whole food plant-based diet. At 6 months, mean BMI reduction was over 4 BMI points, and that remained at 1 year follow-up, suggesting this dietary pattern was acceptable and sustainable for the participants. And the positive impact of plant-based diets was also observed in the absence of weight loss. So in this metabolic ward trial, 20 lean men with long-standing insulin-dependent diabetes were placed on a high carbohydrate, high fibre plant-based diet for 16 days. And the diets were designed to maintain weight, so they weren't to lose weight. All participants were able to significantly lower their insulin, and 9 needed to come off completely. Their post-meal glucose levels were lower despite the lowered insulin doses. And several studies have shown that in various countries, vegan or whole food plant-based diets compared to their country's recommended dietary guidelines for diabetes have helped participants to achieve greater reductions in diabetes medications, body weight, HbA1c, LDL cholesterol, and insulin resistance. And an under-researched area is the benefits that plant-based diets can offer for treatment of peripheral neuropathy. 2 small studies have shown huge improvements in symptoms and nerve function using this dietary pattern. In one study, 17 of the 21 participants eliminated their neuropathic symptoms. And plant-based diets have even been shown to significantly improve many aspects of the psychological well-being of people living with diabetes. So what does all this mean? What should we implement in our own lives, or what should we tell our patients? Well, the very low-calorie diet is now included in treatment guidelines in the NHS following the success of the DIRECT trial I'm sure a lot of you will have heard of. And it works due to the rapid weight loss that happens, and outcomes are directly proportional to that weight loss. So this approach used total diet replacement shakes and soups for around 3 months, and then gradual reintroduction of food. The 1-year follow-up showed 46% of participants in remission, and this went down to 36% by 2 years. So it's clear that if these patients are to remain in remission, they need to find a healthy dietary pattern that they can sustain long-term. And what about carbs? So avoiding carbohydrates is advice commonly given to people with diabetes and even to the general population. And on a simple level, carbohydrates break down into glucose, which is the fuel our body wants and needs for optimal function. And if a low carbohydrate diet is actually achieved, which it's often not, but then there will be a less glucose in the blood, and so less insulin will be needed, and therefore people may see short-term benefits for blood glucose control. But this is definitely a case of mopping up the floor and not turning off the tap, isn't it, to go back to my original analogy. And additionally, there is little evidence to support efficacy beyond 12 months or that such a diet is sustainable for patients. But my main concern as a dietitian will always be, instead of what are the high carbohydrate foods being replaced with? And if this is predominantly animal proteins and saturated fats, then your long-term health will suffer. But also, what foods are you avoiding? Many people who come to my clinic are scared to eat a banana or a handful of grapes, yet they've not been told about the negative effects of animal products and refined foods. So this case series demonstrates that achieving diabetes remission is possible through a healthy diet without severe calorie restriction or liquid meal replacements. In the study, 59 patients with diabetes enrolled in a cardiac wellness program and experienced significant improvement in blood glucose control. And some even achieved full remission by following a low-fat, whole food, plant-based diet. But it's important to remember that when people adopt an improved dietary pattern emphasising whole plant foods, they may well experience rapid improvements to blood sugar control. So this does need to be supervised, and deprescribing may be necessary. That is dose reduction or discontinuation of medications. So this is a useful case series in which practitioners interviewed provided accounts of their deprescribing protocols. And the authors say this provides useful examples for other practitioners of how deprescribing in the context of lifestyle medicine treatment is conducted. So the European Association for the Study of Diabetes has published recommendations for the dietary management of diabetes. They encourage the consumption of minimally processed plant foods, whilst minimising the consumption of red and processed meats, salt, sugar-sweetened beverages and refined grains. And they highlight that these recommendations for people with diabetes are largely similar as those for the general population. And that would look something like this: the whole food plant-based plate from the American College of Lifestyle Medicine. And of course, these ingredients can be put together into composite dishes such as curries, tray bakes, stir fries, risottos, and pasta dishes. So an important new study by ACLM has found that there's considerable agreement among major organisations regarding the benefit of consuming minimally processed whole plant foods to treat and prevent chronic diseases such as type 2 diabetes, cardiovascular disease, and cancer. And this unique study compared dietary and nutrition recommendations of 78 clinical practice guidelines, finding that nearly 75% of them recommend including or increasing consumption of vegetables, 69% recommend the same for fruit, and 58% for whole grains. And the authors concluded that this close alignment is good news for clinicians. Understanding that there's consistent agreement rather than debate should increase clinicians' confidence that they're making sound evidence-based recommendations to their patients when recommending increased consumption of unrefined plant foods. So I'm a dietitian, so I can't go without giving you a couple of practical tips, whether it be for you or your patients or your loved ones. People need support to interpret the science and put it into practice. And there's so much confusion out there, isn't there, in the general press as well. So firstly, please don't be afraid of eating fruit and of recommending fruit to your patients, even your patients with diabetes, as a great snack or dessert to your patients. And so often people with diabetes will choose a shop-bought snack bar. You know, I often find they have granola bars and things like that over a piece of fruit because they're so scared of the sugar in the fruit, and they've been told even by health professionals that they should avoid them. And the snack bar is advertised as healthy, isn't it? But unlike sugar-sweetened beverages and refined grains, natural fruits are not associated with fatty liver. This is for a number of reasons. Fructose is harmful in large amounts, and contrary to popular belief, a piece of fruit doesn't actually have large amounts of fructose in it. And the fructose in fruit is not free, is it? It's bound within the structures of the fruit and will therefore be digested much more slowly. And additionally, it comes packaged with other nutrients such as flavonols and vitamin C and other antioxidants, which may protect against the damage caused by free fructose. So when working with clients, I tend to focus on adding things in rather than restricting. So encouraging them to fill the plate with more whole plant foods. And this will gradually push out the refined carbs and the animal products. So encouraging people to add in more and more whole plant foods to their basic meals will also strengthen the message that this is not a restrictive diet. You know, ask people, what could you add to that when they tell you what meals they have? You know, talk about adding things rather than taking things away. And helping people to consider swaps is a really useful way for them to realise they won't be deprived as well. Most people just have a handful of meals that they make or buy regularly. So thinking about how those meals can be made more plant-based can really help and be really practical for people. So try to get specific with advice and suggestions. So, you know, obviously starting with encouraging them to swap things like white breads, pasta and rice for whole grain versions is a really easy one. And then ask people what their 3 or 4 most regular meals are and suggest ways to make them more plant-based, such as using lentils or corn instead of beef mince, for example, in a ragu, or making a bean casserole instead of a chicken one, or even starting with half and half. I quite often do that with my patients, you know, encouraging them to swap out half the meat for a tin of beans and lentils and, you know, gradually up that over time when they get used to the taste. And help people by signposting them to good Instagram accounts to follow or to websites to look at, including ours, of course. The 21-day plant-based challenge is a great place for people to start and meet people where they're at, taking them at a realistic pace for them. But having said that, it is important to be honest in terms of the evidence and tell people that bigger changes will yield bigger results. Moderate changes bring moderate outcomes. And certainly, if we're looking for remission, you know, if someone's needing to lose a lot of weight and wants remission of diabetes, then bigger changes may be needed for them. And they may even have to limit higher fat foods, such as nuts and oils and avocados initially to get that weight loss. But they would need individual advice in any case and monitoring, wouldn't they? So what does this look like when it comes to everyday meals? Well, this is just a small selection of photos from my camera roll. Some of my meals and snacks. In typical dietitian, I like to take photos of my food. So yes, it is my food, but all of it would be appropriate as well for someone with diabetes. So let's start on the right here. We've got a couple of blank breakfast canvases, porridge, oats or toast. You know, you can have endless variations of those, can't you? I'll change up in my oats what I have in terms of spices that I add. I might have cacao one day, make it chocolate porridge. I might have cinnamon and apple another day. Change up the fruits and the seeds and the nuts that you add. And similarly with toast, I'll change the bread. I might have rye bread or sourdough or whole grain, and then the toppings can change depending on what I've got in, what I fancy. So peanut butter and banana actually is a common one for me, not pictured here. I've got hummus and avocado there, haven't I? And there's some whole food snacks as well. Some figs at the top left there from a market whilst I was out and about. Or a typical day in the office for me would be nuts and raisins in the afternoon. And then for lunches, a couple of lunches there. I often just see what's in the fridge and have leftovers or sandwiches or something on toast. So I've got the top middle one there is tofu mayonnaise, so sort of an egg mayonnaise alternative with silken tofu. Or just beans with salad. Encourage people to have a fridge well stocked with salad and veg, and to cook too much of everything. I always deliberately cook too much of everything, so there's always leftovers to grab, and that even goes to the grains. If I'm cooking rice or quinoa or anything like that, I'll always cook too much so that it's there for my lunch. Dinners will be curries, soups, pastas, risottos. And here's what I mean by sort of asking, what can you add to food? So, whether there's any extra veg in the fridge or any extra plant proteins or nuts and seeds that you can throw on the top. So, this is a soup. And this over here, the top right there is a sagaloo. So that's potato and spinach curry. And they've both got a lot of stuff, extra stuff added. Tofu, spinach, pumpkin seeds on the soup. There's tempeh, peas and rocket on the curry. In fact, I had that curry only a couple of days ago, and that was lunch the next day when I added all those extra bits on the top. And also it helps people to get enough calories and protein when they add in all those extra bits, so they're less likely to be hungry later and more able to resist the evening snacking, which is the killer for a lot of people, isn't it? And then the other 4 photos are all of when I've eaten out. So I just want to say, you can eat out, and don't be afraid to ask if there doesn't look like there's much on the menu. For you, I was in Germany just at the weekend, and I went to place. I was with a load of meat eaters, so we weren't really looking for vegan restaurants. And I went to somewhere that they only had vegetarian meals. So this beetroot couscous in the middle here was on the menu with feta. But they were happy to just make it for me without feta cheese. It was delicious. I really enjoyed that. If I go to a barbecue, I might take some vegan, plant-based burgers. And take more than just for me, so you can share the food with people. You can use apps like Happy Cow and things like that to find nice vegan restaurants. So yeah, don't let it put you off eating, and encourage your patients and people you're helping that it is easy to eat out. It's getting easier and easier, isn't it? So please do look on our website and use the resources that we have. We've got some great fact sheets, and the 21-day plant-based health challenge is a really good place for people to start. And in summary, we need to consider the cause in order to effectively prevent and treat diabetes. Animal products and heavily processed foods contain many nutrients and compounds that are harmful and increase risk of diabetes. And whole plant foods are protective and reduce our risk of diabetes due to the fiber content and many beneficial nutrients. And we need to seek support or support others to make the transition towards including whole grains, beans, fruits and vegetables, nuts and seeds in our diet. So thank you for listening, and obviously I'll be happy to answer any questions now, and the slides have got the references on the end as well. Thank you.
Amazing. That was wonderful. Let me just change the view so everyone can see us side by side. That was so thorough and absolutely fantastic. I was riveted. As someone who has a genetic form of diabetes myself, not type 2, not type 1, there is another whole category called monogenic diabetes. It just shows how complex these conditions are, but also we can do so much through nutrition and lifestyle. And I think my favorite bit was you showing all your favorite meals and everything. It just looks so colorful and vibrant. And I think the point about getting people to focus on what they can add in. So often the focus is on cutting things out, and that can be really overwhelming for people. So Claire, I'm going to go straight to the Q&A because people have got some burning questions for you, and let's try and get through them as fast as we can. We've got about 15 minutes. Do put them in the Q&A box because otherwise I can't access them as easily. So someone has asked about processed foods. I think there's someone who actually has diabetes. They said, I've been told to avoid processed foods because it's not good for diabetics. Is plant-based food considered processed food?
Okay, yeah, this is a complicated one, isn't it? I mean, obviously, you know, as I've pointed out in the slides, a lot of the refined foods, you know, if we're talking about sort of donuts, pastries, then, you know, obviously we know, don't we, that we want to avoid having too many of those. Doesn't mean to say you can't have any at all, but I think there is this thing at the moment, isn't there, about plant-based foods being processed, particularly even things like plant-based milks, and the plant-based meats and things like that. And we do have to look at, you do have to be measured about it. So, you know, looking at plant-based meats, yes, there are several ingredients in there, but I've also pointed out all the things that are in proper meat. That's one ingredient, it's just meat, but it is full of compounds that are harmful. So that it can be quite deceptive, can't it, looking at that ingredients list? And yes, there will be some meats, you know, do get used to looking at the ingredients, and there are some that are better than others, some that are quite high in sort of things like coconut oil, and some that are higher in fiber and things. But there has been studies started to be done now on comparing sort of head-to-head plant-based meats with normal meat, and they are coming out generally better. So, and certainly with milk as well, and plant-based yogurts and things like that, you know, they're essentially, you know, like an oat milk is essentially oat and water, and it might have a tiny bit of oil in so that you can whisk it. But it's also fortified, isn't it, with, you know, a lot of the nutrients that we want, like B12 and vitamin D and things. So they are a healthy part of a plant-based diet. So, and we're talking about sort of what you focus most of your plate on, aren't we, as well? So, you know, if most of your plate is whole plant foods and you have small amounts of processed foods, then that's fine. That's a balanced plate. If you're living off completely processed food, then that's not going to be good for you. I'm sure you've probably got things to add to that, Rahini.
Yeah, I think just drawing the distinction between ultra processed foods, which are food substances, and some processed foods are actually healthy, whether it's nutritional yeast or you know kimchi or whatever. It's understanding that it's the overall dietary pattern that's most important. So basing your meals around those whole plant foods, that's where you're going to really thrive. And some really amazing questions. So I'm going to read this one out next. I've got older patients who are about 60 to 75 years old who are low fat, whole food, plant-based. They exercise 5 times a week. They don't drink or smoke. They initially see improvements in glycemic control and weight loss, but then they seem to plateau. Do you have any advice, or do you think perhaps they've had diabetes for too long and there's a limit to how much improvement we'll see with lifestyle changes?
Wow. So I'm presuming these are people that have got type 2 diabetes then, from the question, and have had it for quite a long time. Yeah. Yeah, I mean, that, so I'm presuming you mean plateaued in terms of like the HbA1c has only gone down to a certain level. Yeah, I mean, it is difficult as well with older people. You don't want to restrict them too much, and you don't want to lose too much weight either, do you? So yeah, I think, I mean, there can be little things that they can tweak, you know, like the amount of sort of the higher fat foods and things like that in the diet as well. And just making sure they have got a lot of fiber in the diets. But yeah, I mean, I definitely think that probably is the case of, you know, you don't want to be too restrictive with older people.
Definitely, and there's still a role for medication and other things, and certainly diabetes always involves what type 2 diabetes and various other forms often involve the destruction of the beta cells. And yes, the longer it goes on untreated, the more destruction there will be. But I am surprised to hear that they have plateaued. Generally, with that type of lifestyle, whole food, plant-based, no exercising that much, you would see remission for most people. So it is really interesting, and perhaps for them a big goal could actually be putting on some muscle, which does get harder after the age of 30 even, but changing body composition can be a really good goal. So strength training to improve insulin sensitivity, and definitely getting sufficient plant protein in the diet. And that's something I would say is a lot better than focusing on weight loss for older adults. actually changing the body composition. So that might help someone who's plateauing to introduce more strength training, and maybe working with a dietitian who specializes in diabetes to help you with that. What would you recommend as breakfast ideas for an adult who struggles to get enough protein in that first meal of the day, and how many grams would you suggest?
Okay. So, I mean, really, we're looking at sort of, I would say, 1 gram per kilogram of body weight over a whole day. So, you know, your breakfast, you may want to try and get about 20 grams of protein in 15, 20 grams. But yeah, I mean, there's plenty of high protein breakfast. You know, the tofu mayonnaise I had on the picture there, you can do scrambled tofu on and you can even get protein into your things like your porridge by adding sort of seeds, and making sure you use soya milk, and adding extra nuts and things. So have you got any ideas, Rahini? Breakfast
Yeah,
ideas?
I think it's, again, with protein intake, it's getting good regular amounts spaced throughout the meals throughout the day. That tends to be ideal, so that you're not having an overload. For older adults who are doing strength training or struggling to eat enough, then adding in a plant-based protein powder like a pea protein powder could be helpful. But generally, the vast majority of people don't need that. And choosing options, exactly as you said, the tofu scramble, whole grain oats with soy milk. In India, we have, and this is popular in a lot of vegan recipe books, we use chickpea flour to make pancakes, which is really delicious. And you don't always need to eat sweet breakfast. Remember that you can eat savory food for breakfast as well, and do a nice brunch with lots of different things like, yeah, tofu scramble and mushrooms, and add in things like nutritional yeast to bump up the protein content. So there's no reason you can't get all the protein you need on a plant-based diet, and nothing to be worried about at all. But lots of tips on our website as well for that, and the 21-day challenge. Quite often we are fixated on protein, and we actually need to be more concerned with whether we're getting our fiber. Only 1 in 10 adults in the UK is getting enough fiber. This is an interesting question. I'm a 74-year-old plant-based eater, and I've read that I need to eat more protein, especially as I do weight training twice a week. I hate all soy products. Any idea where I could focus on getting enough?
Okay. Yeah, well, I mean, obviously, all your beans and lentils are all good sources of protein, and actually more than you would think a lot of the grains are as well. So quinoa's really high in protein, buckwheat's really high in protein. Obviously, you can use the plant-based meat alternatives as well, and things like seitan. I don't know if you've tried seitan, but that's you know, you can make that with the flour, so, or you can just buy it ready made, but
Yeah.
that's very, very high in protein as well. So some ideas for non-soya proteins.
And you could add in a pea and hemp-based protein. There's also lots of plant-based meat alternatives, as you said, that are based around pea protein. And there's a brand called Profusion. We prefer not to mention brands here, but it is a nice one where they've got fava bean chunks and pea protein chunks, which are great. You can throw them into stir fries and other dishes and curries. But remember,
the other thing as well is getting pastas that are made from sort of chickpeas and things like that, rather than just your whole grain pastas. They're higher in protein as well.
given your age, you probably don't have a huge appetite or ability to eat that volume maybe of the beans and things. So that's why it's great to add in diversity of beans and things, but those concentrated sources like the seitan are going to be helpful here. So, okay, what would you say to someone who criticizes the vegan diet for being high carb and difficult to eat a high amount of protein whilst also eating a lot of carbs? I guess you can eat high protein on a vegan diet, but in this case, it would be highly processed.
Well, I don't think it does need to be highly processed to be high in protein. But yeah, in terms of the carbohydrates, it's the type of carbs, isn't it? Carbs just get such a bad rap, and the type of carbs is what matters. So there's carbohydrates that are unrefined carbs, you know, sort of vegetables, as we've said, all the whole grains, sweet potatoes, your potatoes with skins on. All of these carbohydrates are all really good for you and are not a problem. Obviously, if you're if you've got type 1 diabetes and you're counting your carbs, you have to be aware of the amount of carbs and count them. But it doesn't mean to say you can't have them. All those sort of whole grain, whole food carbohydrates are really good. The carbohydrates that are going to really affect your blood glucose are the sort of sugary foods and the highly refined grains that we've talked about. So
Completely agree. go for those intact whole grains, barley, oat groats, red rice, brown rice. That's where your, quinoa, buckwheat, all of those are your friends here.
Yeah.
Hello, Claire. Please tell us about those rogue skinny diabetics. No obvious visceral fat. Is it related to the personal fat threshold?
Mm. Yeah, I mean, my understanding is it is. Obviously, there's genetics involved, isn't there? And obviously, as I talked about, it's different ethnicities are susceptible at different levels as well. But yeah, I think my understanding is that everybody does have a threshold of how much sort of subcutaneous fat they can hold before it starts spilling over, if you like, into the visceral ectopic fat, which is the dangerous fat there. And yeah, unfortunately, some people do just are not able to hold as much fat and will be affected much sooner. Is that your understanding as well, Rahini?
Yeah, exactly. So the personal fat threshold was sort of, I think, hypothesized or sort of put forward by Roy
Roy
Taylor,
Taylor,
his,
yeah.
his work on that. And it is interesting. There's also does appear to be some ethnic differences. In leaner South Asians, for example, beta cell destruction appears to happen at an earlier age and tends to be more aggressive. There's lots of different reasons why these things can happen. There's also like autoimmune dysfunction that can affect people. There's so many factors. Type 2 diabetes is a multifactorial condition. Some of my patients with type 2 diabetes try a whole food plant-based diet. They find that their HbA1c rises and they blame the carbs in whole grains. Is there any evidence that whole grains increase blood sugar?
Well, I mean, ultimately, they are carbohydrates and they will be broken down into glucose. So I suppose whilst you've got, so when if you first start when you first change to a plant-based diet and you have got diabetes, you obviously are, if you've been on quite a low carbohydrate diet, you are increasing the amount of glucose that's entering your blood. But what you're also doing is over the next few weeks, you'll find that liver fat will start to melt away, the fat in your muscles will start to melt away, and your insulin resistance will improve. So you'll be able to handle that extra glucose much better. But as I said, it's, from whole grains, it digests really slowly. So you shouldn't really get the fast rise in blood glucose that you would from a sugary carbohydrate.
And we have to look at the evidence. There are hundreds of studies, if not thousands, showing that whole grain consumption is associated with reduced risk of type 2 diabetes. And we know that, again, comes back to those intact grains. So go and try and, rather than instant oats, which have, I just learned this today, they have a glycemic index of around 83. We know that steel cut oats and oat groats have a glycemic index in the low 50s. And that means that they raise blood sugar to a lesser extent, and also combining those with a handful of nuts, berries, other fiber-rich foods, you're going to see much better control. So, yeah, it's so hard for us to comment on individual patients because we don't know what else they're eating or doing. What do you suggest, Claire, for older people in their final years who've got no interest in changing their diets? What becomes the priority for them?
Yeah, I mean, it is different priorities, isn't it? I find this one really hard, actually. And to be honest, the priorities do change in terms of, we don't want them to lose a lot of weight, so we do need them to have the calories. So you do start advising that more high fat foods, because that's the way that it can get the fat calories in small volumes. And that the priority of the sort of not losing weight, because they become very frail, very vulnerable to falls, but more vulnerable to infection and things like that, it sort of outweighs the other priorities that you might be worrying about in younger people. So the priorities definitely do change, yeah.
I agree. And someone's asked about what the sensible range of protein intake is. And I think the minimum we suggest is 1.2. We suggest getting 1.2 grams per kilogram, and for some older adults, even slightly higher. Yeah. Lovely comment saying that I just completed the 21-day challenge and I thoroughly enjoyed discovering new vegetables, and I'm excited to continue eating a whole food plant-based diet, which is just lovely to hear.
Yeah, that's really lovely.
Claire's challenge, I pasted it in the chat, and I've also pasted a link to our membership, but it's absolutely incredible. So do check that out because it's totally free and you'll get lots of motivational emails, lots of recipes, lots of lovely comments. Such a fluent and comprehensive talk. What a brilliant talk. I am going to ask one final question, which was really comes from Despina, who's a dietitian in our group. Are there any recent studies that you might be aware of comparing a whole food plant-based diet with a Mediterranean diet? Do you pay attention as a dietitian to glycemic load?
Yes, there was one very recently, wasn't there? Was it Neil Barnard?
It
Was
was, I think.
Yeah.
Shireen posted it.
Yeah, there was. And I think it held its own. To be honest, I did read it and I can't actually remember the details about it now. Um, do I pay attention to glycemic load? I mean, I certainly don't calculate it, no. So glycemic load is sort of glycemic index, but you're taking the amount of food into account as well. It means that foods like watermelons and things like that are really high glycemic index, if you actually take into account how much you're going to eat in one go, it's not as bad as it seems. Um, I mean, I generally eat a mainly whole food plant-based diet, so I don't worry because I know that that's all food that's getting absorbed slowly and breaking down slowly, and it is quite good glycemic load. So I don't tend to count things and weigh things and worry about things like that. I think if you know that you're eating high quality foods, then you can sort of relax about things like that.
Yeah, I completely agree. I think it's more looking at the quality of foods in your diet rather than
Yeah.
fixating on glycemic load or glycemic index. And someone's posted the study there. Yes, again,
Good.
there's a big difference in different Mediterranean diets, but we certainly know that plant-forward Mediterranean diets can be very helpful. And someone's also asked about the low-carb diet for type 2 diabetes that's plant-based, and there is one called Eco Atkins, which you can look up some of the studies on. If there are people that are utterly wedded to a low-carb approach, then an Eco Atkins diet is certainly going to be much more heart healthy than having a traditional ketogenic or paleo or low carb animal based diet. And there are certainly different things they can add in. There are things like lupini beans, which are quite low in carbs. And there are certain people where they may benefit from moderating their carbohydrate. It's not for most people, but people who've got high levels of beta cell destruction and things. But again, it needs to be discussed with your team. All of this, none of this is individual advice. It's really important if you have diabetes not to kind of just come off your medication. It can be really dangerous.
Gosh, no, don't do that.
All of this, gradually getting more insulin sensitive is really the goal. And that can happen if you are going to change your diet radically. It's very important to speak to your doctor because there are cases where people have gone on a whole food plant-based diet, they become very insulin sensitive, and then their insulin needs decrease and they're not changing things up. So we just want to caveat that. There are also brilliant fact sheets and lots of other tips on our website. We've done previous webinars on this topic with the amazing Brenda Davis as well. So if you're interested in this topic, you can watch the recordings by joining us as a member. But I'm very grateful to